Hello, my name is Dr. Bob Bollinger, Professor of Infectious Diseases at Johns Hopkins University School of Medicine. I'm also the Director of the Johns Hopkins Center for Clinical Global Health Education and a member of the Faculty Steering Committee for the Johns Hopkins India Institute. Blood tests are generally not necessary for the majority of people with COVID infection. In particular, it's not necessary if you're well enough to go home. The only time that blood tests are typically necessary are for people that are sick enough to require hospitalization. There are tests such as the CRP test, and the IL-6 test, and the D-dimer test, which you may hear about. The CRP test and the IL-6 test are tests that measure your body's inflammation and how your body is trying to fight the infection. And sometimes our bodies can be highly activated and inflamed from this infection to a point where it can cause difficulties. And so your doctor may measure that amount of inflammation. It helps the doctor determine what kind of medication might be helpful for you at that time. The D-dimer test is one of a number of tests that are often used to determine whether patients are having what are referred to as blood clot problems. And unfortunately, in a subset of people, not everyone, in some people with this infection who are admitted to the hospital, again, it's generally, these are tests only done in people admitted to the hospital. They're generally not necessary for the majority of people who are cared for at home. But the D-dimer test is used to determine whether or not you need specific kinds of anticoagulation or blood thinners to prevent blood clots. So there are some new treatments that are being studied for treatment of this disease. One of those is what's called budesonide, which is an inhaled steroid commonly used for asthma patients. There's some recent studies that suggest that medication might be particularly helpful for people to prevent them from getting severely ill. We're not exactly sure which patients will be the most likely to benefit, but you might have some physicians prescribe this inhaler for people who are at high risk for disease. But it's important to realize that this medicine should only be used in people who have normal oxygen in their blood. Once the oxygen is dropped below a certain level, oxygen therapy is what's necessary for these people. And medications and inhalers like budesonide may not have as much benefit. So it's something that might be tried, particularly in people who have normal oxygen, have mild disease, but are particularly at high risk for more severe disease to help them recover. But we're still learning a lot about these kinds of medications, and at this point, it's not something that's done routinely for everyone with this disease.